There, it's Brenda Cassidy, creator of the BrainCam program. I just wanted to make a little video for you today to explain a few things about fidgeting. And fidgeting is something that happens in every classroom right across the world, I'm sure. Very, very common. So there are 4 types of fidgeting. So you can have mouth fidgeting, which we call oral seeking. It's a sensory seeking behavior. And what that looks like is chewing the top of pens, chewing the top of bottles, sometimes the top of sleeves or necklines of a jumper, for example, okay? Also, we have foot seekers or fidgeters, where a child might be kicking the leg of a chair constantly. What that child is trying to do is tell him or herself where his foot is, okay? They're trying to tell their brain where the foot is, and the brain does not feel comfortable until it knows where the foot is, okay? There's whole body fidgeting, so that's might look like the child who's always moving around and squirming. He might be sitting on his feet, had the legs wrapped around the 2 front legs of the chair, walking around, paring a pencil constantly, and that's a form of whole body fidgeting, okay? And lastly, hand fidgeting, which is very common. So this might look like a child who's constantly click, 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 click with a pen, all right? Or something else. So that child, again, is trying to tell his brain where his hand is because the signals aren't getting through properly, okay? They're not being processed correctly. So the brain doesn't feel comfortable until it knows where the hand is. So I often talk about, when I'm teaching about this in workshops, if you were craving, absolutely craving a cold drink on a hot day, you're not going to be able to concentrate on learning something new until that craving is met. This is the same with these children who are fidgeting. So I really want everyone to understand you must feed the fidget in order to get the child to concentrate. Obviously not with food, but with something that will settle down that fidgeting and feed that fidgeting, okay? If you had a hungry child, you would feed it food. If you had a thirsty child, you would give it a drink. So this is a craving. So just in terms of hand fidgets, this is my favorite tip. Just a few tips and hints. Blue tack, plain old blue tack, fantastic. My boy would have this in his pocket all the time. He's a chronic fidgeter. This is a form of sensory seeking. Any of you who've done my BrainCam Foundations course and you know that I use my unique color coding system, this falls under red sensory seeking behaviors, okay? So lots of quiet fidget time there with the blue tack in the pocket. It's really handy and really, really cheap, okay? Also, you can take some Velcro, cut a piece and put it under the child's table so that they can fidget with it, and when they have that craving met, they'll be able to concentrate on what you're saying. It looks the opposite. It looks like the opposite is true, but it isn't, okay? You can also, if a child is seeking the touch of a particular material, such as velvet or denim, you could take a little square of that, cut it out, and again, stick it under the child's desk so he or she has something to feel and to fidget with, and that might help settle him or her down. You can also get quiet fidgets. You don't have to go to therapy stores to get anything fancy. If you go to Walmart or Target, or if you're in Ireland, Mr. Price, you can get like little rubber dinosaurs, anything that's quiet, that doesn't distract the other children and doesn't distract the child, that doesn't disturb the other children. So nothing noisy, nothing with bells or crackles or anything like that. Just something plain, like plain old little rubber thing. If the child tends to put things in their mouth, though, just be careful in case it's toxic, okay? So that's just a few hints and tips for the fidgety hands. Very quiet and very, very common. And thank you for listening, and I'll see you again. Take care.